Good morning, everyone. Welcome, respected colleagues, dear friends, and distinguished guests. It's my pleasure to welcome all of you
Recording in progress.
on the third CUPID Annual Conference. This year's theme is Uniting Knowledge and Practice, reflects our shared commitment not only to generating knowledge, but also to translating it into real-world impact for people with intellectual disabilities. People with intellectual disabilities representing approximately 200 million individuals globally face with significant disparities in cancer prevention and care. While cancer remains one of the leading causes of mortality worldwide, the intersection of cancer care and intellectuality presents unique challenges that demand specialized attention within healthcare systems. Over the past 3 years, we are at the end of the third grand period. CUPID has grown into a vibrant and collaborative network of researchers, practitioners, policymakers, families, and self-advocates. Together, we are breaking barriers, addressing gaps, and shaping a more inclusive approach to cancer prevention and health promotion. What once started as an ambitious idea has now become a truly international platform where expertise meets practice and where innovation meets compassion. This annual conference provides us with a unique opportunity to share new evidence and highlight key challenges in cancer prevention for individuals with intellectual disabilities, strengthen cross-national collaborations, ensuring that research findings inform policy and practice in meaningful ways, and empower early career researchers and professionals from less research-intensive countries to join this mission and grow within an international community. We know that health disparities are not just numbers in a report. They represent lives, families, and communities. CUPID's work is about ensuring that individuals with intellectual disabilities are not left behind, but rather placed at the center of our research and preventive strategies. Over the course of today's program, you will hear from colleagues who bring fresh insights, practical solutions, and inspiring perspectives. I invite all of you to engage actively, ask questions at the end, share your views, and think about how the knowledge we generate can be transformed into tangible actions that improve lives. As we move into our fourth year in November, let us reaffirm our mission to unite knowledge and practice in the services of equity, dignity, and better health outcomes for all. Some technicalities on the very beginning. Please turn off your cameras if you are not a speaker, and microphones. Turn off. We will give you a speech and word after all 5 speakers. During the web conference, you can send your questions or comments to the section Q&A or into the chat. Each presentation should last around 10 minutes. At the end, there will be a question and discussion session, as I mentioned. Enjoy the web conference, third conference, each October. In last 3 years, we organized this annual CUPID conference. So, I will stop my presentation, welcome speech, and I am inviting first speakers, Dr. Margaret Denny and Dr. Oliwia Kowalczyk, to take the floor. The title of their presentation is Enhancing Inclusion in Career Prevention, a Scoping Review to Guide Co-Production and People with Intellectual Disabilities. Please.
Good morning. Can everybody hear me?
Yes, you can go on, please.
On behalf of Dr. Oliwia Kowalczyk and myself as co-leads of this presentation of Working Group 1, I would like to welcome you all here this morning. to listen to us talking about our scoping review, Enhancing Inclusion in Cancer Prevention, to a scoping review to guide co-production with people with intellectual and developmental disabilities. The problem in terms of, I just need to, sorry, 1 minute, just move. Yeah, the problem is that we have cancer disparities. People with intellectual disabilities face profound cancer disparities, and the mortality ratio or relative risk compared to the general population is 2.28 are more likely to die from breast cancer, 2.57 are more likely to die from colorectal cancer, and 1.38 are more likely to die from lung cancer. They remain largely excluded from cancer prevention initiatives. So the review actually aimed to analyze existing literature on co-production involving people with intellectual and developmental disabilities to inform future cancer prevention strategies. Our primary research question was, how can co-production be effectively implemented with people with intellectual disabilities and or their support persons, carers, or clinical staff? So the objectives were to investigate where co-production has been applied with people with intellectual and developmental disabilities, describe characteristics, benefits, and limitations in terms of those studies, and identify research gaps. For our scoping review, we used Arsky and O'Malley Framework 2005, Joanna Briggs Institute adopting the preferred reporting items for systematic reviews, Prisma SCR. And in many ways that enhanced our methodological transparency and reporting quality. The databases we used were Scopus, PsycInfo, CINAHL, Medline, and PubMed. The process, well, independent screening by multiple reviewers on our team. And at this stage, I'd like to thank all the people on the research team who were part of this scoping review, and it's now sent to the Journal of Intellectual Disability and Research, and it's under review. We used English language and peer-reviewed publications only. No critical appraisal of individual studies was undertaken in keeping with the scoping nature of the review. The objective was to map and describe the extent and nature of the research in this area and to evaluate the quality of the studies or risk of bias included in the studies. The search results. From the search synthesis, the records we identified through the database searching were 562. The records screened were 309. Full text articles assessed 103, and we ended up with 31 studies included in the final review. What did we find? Well, geographic distribution, we had UK, Australia, USA, Canada, Belgium, the Netherlands, Norway, Germany, France, and Ireland. Our sample sizes ranged from 3 to 83 participants, and they included people with intellectual disabilities, carers, healthcare staff, and researchers. The methods Used in the studies were qualitative co-production, focus groups, photovice, which is photography and narratives to document their lived experience. We found experience-based code designs or narrative-based research and service design methods, applied theatre, arts-based methods, digital storytelling, which I think is very interesting, where they use multimedia images or elements like images, audio, video, and text. The critical gap, who's missing? Well, the majority of studies, as you probably already knew, only included people with mild to moderate intellectual disabilities, and people with severe or profound disabilities were severely underrepresented. So the implications: voices and experience of those with greater support needs were absent. Risk of designing interventions that do not meet diverse needs to be addressed, and it perpetuates the existing exclusion that people with intellectual disabilities face. Well, we had 3 key themes emerged after we reviewed in depth the 31 studies. So what we concluded, what shapes effective co-production, is interpretation of co-production and sub-themes in terms of concepts, definitions, and frameworks, ethical considerations and sub-themes, consent, recruitment, power dynamics. And the final third theme that was identified was authentic engagement, and the sub-themes in terms of what methods did they use in terms of co-production, communication or augmentative communication techniques, what did they use, and that is sadly missing, and then generally resources used to engage people with intellectual disabilities. I now would like to pass you on to Dr. Oliwia Kowalczyk to continue the presentation. Thank you.
Okay, thank you very much. To continue, yes, we found in the scoping review the problem with the definition. In those only 8 of 31 studies explicitly defined co-production, and this term was frequently conflated with public and patient involvement, co-creation and consultation. And this conceptual ambiguity is problematic because some studies labeled single consultation meeting as co-production, while others involved participants through the entire research cycle. So without definition clarity, tokenistic involvement can be presented as genuine partnership. And this inconsistency also prevents meaningful comparisons across studies and identification of best practices. Slide 10, we found the proposed definition we would like to, based on our review, we would like to propose this definition. I'm not sure if this is the...
Sorry.
Yeah, thank you. Yes, so as you can see, it's cited in the slide that co-production is a collaborative process where people with intellectual disabilities work as equal partners with support as needed to identify their priorities and to design, deliver, and evaluate services or research, ensuring their voices and experiences shape outcomes. The key elements include equal partnership, priority identification by people with intellectual disabilities themselves, involvement throughout the process, and genuine influence on outcomes. And now we go to ethical considerations, yes. So the 3 ethical imperatives emerged. First, consent must be ongoing and supported, not a single transaction. Successful approaches used easy read formats, visual aids, and multiple conversations while prioritizing the preferences of people with intellectual disabilities. And the next slide, please. And the second, recruitment strategies predominantly relied on service providers, systematically excluding those outside formal care systems. Diverse recruitment pathways are necessary. And the third of our findings in this issue was power imbalances persist even in collaborative projects. Deliberate mechanisms for power sharing are required, not just good intentions. The payment gap is also something we've noticed. Only 3 of the 31 studies mentioned compensating people with intellectual disabilities for their participation. So researchers and healthcare professionals are remunerated for their time, yet people with intellectual disabilities whose expertise is supposedly valued are typically expected to volunteer. So we claim that this reinforces the power imbalances co-production aims to address. The next, please. The authentic engagement, yes. Effective practices included preparatory training, accessible multimodal communication, creative methods such as photo voice and applied theater, adequate time for relationship building and peer researchers. Technology, including virtual reality, digital storytelling. However, authentic engagement is resource intensive. Studies consistently reported needing more and funding than anticipated. Current grant structures and short timelines create barriers to meaningful implementation. This is what we found in this scoping review. As far as implications for cancer prevention are concerned, initiatives must begin with priorities identified by people with intellectual disabilities themselves. Recruitment must extend beyond service providers. All cancer prevention materials should be co-designed using the successful methods identified, which is visual storytelling, peer-led approaches, multimodal communication. Cancer prevention requires sustained engagement for screening and monitoring, necessitating long-term relationships. So this requires adequate resourcing and realistic timelines. Critically, we must develop methods that include people with severe and profound disabilities who currently face both cancer risks and systematic exclusion. And we come to conclusions. Co-production is widely endorsed, but inconsistently practiced with people with intellectual disabilities. Conceptual clarity is essential, as without clear definitions, tokenism persists. Ethical considerations, including ongoing consent, diverse recruitment, and power sharing, are fundamental. Authentic engagement is achievable, but resource intensive, requiring preparatory work, accessible communication, adequate time, and, what is very important, trust building. Significant gaps remain, particularly underrepresentation of people with severe disabilities, insufficient priority setting by people with intellectual disabilities, and lack of compensation, which was already mentioned. For cancer prevention, these findings provide an evidence-based foundation for developing inclusive, effective initiatives. And the next steps. We are developing co-production protocol for cancer prevention informed by this review's findings. Broader systematic change is required, meaning funding structures must accommodate authentic co-production timelines and resources. Training programs must equip researchers and practitioners with partnership skills, and tokenism must be challenged wherever it occurs. And yes, these are our findings. It was a pleasure to co-present it with Margaret. We are hoping for positive reviews, so please keep your fingers crossed for our scoping review.
Thank you very much, Dr. Margaret Denny and Dr. Oliwia Kowalczyk, for your very insightful presentation, for leading the WG1 group on a very appropriate way. And I hope at the end of the conversation, there will be some question for your presentation and some comments. We now should move to our next contribution. Dr. Vladimir Vukovic will provide an overview of the WG2 CUPID COST Action activities during November 24, October 25. This is an excellent opportunity to look at our progress and plans for the coming period. And Dr. Vukovic, please proceed with your presentation.
Yes, hello everyone. Thanks for having me. I will present overview of our group's activities on behalf of Professor McMahon and myself. So let me just see if you guys can see now full screen. Okay. So our main objective is to focus on EU policy in the area of cancer prevention and to understand if these policies, these programs are adapted to people with intellectual disabilities. We have several tasks, among which exchange knowledge and experience on different health systems, how they work, then to conduct an audit and evaluation of these systems to understand if as I said, policies are adapted to people with intellectual disabilities, and to identify additional research and training which would be necessary to improve it. Even more important, we have deliverables that we need to provide, and basically we are working on these for the past 3 years, and we will continue in the final year of the project. So the deliverables are developing a knowledge base on the minimum of the EU policy standards, first to identify if there are, and then to point to those that are most relevant, to organize a training school, which we did, you will see further on our presentation, to organize STSM, short-term scientific missions for our members, and to work with other groups, Working Group 4, 2, and 1, and to disseminate all these findings. So during the last year, we've been quite active. Our main focus, as I said many times so far, was to do audit and evaluation, to organize training school, and to prepare some publications. We had several meetings. Basically, every 2 to 3 months, we have an online meeting, and we have weekly or even bi-weekly meetings and exchanged emails between our members. So what was the most important in the previous year was basically the training school, and we had some intensive preparations for this with the Working Group 2, did this together with colleagues from the Working Group 3. And we like to say that this was a major event, and to add that this was a major success for our groups and for our CUPID in general. The name of the training school was Equitable Cancer Prevention and Screening, Advancing Inclusion for People with Intellectual Disabilities. 2 days in May this year at Trinity College Dublin was organized this training school. The day 1 was basically fully dedicated to Working Group 2 activities. You can find more details on day 1 and day 2 on the website that you can actually find on the CUPID main website. You can find the links there. Training school was organized at the day 1, fully focused on cancer prevention policies, audit and evaluation. Day 2 was dedicated to Working Group 3, focusing on universal EU cancer prevention strategies, on the methodology of this. And day 3 was additional conference that was not part of the CUPID, but it was very much related to CUPID activities. It was International Cancer Conference in Intellectual Disabilities, fully organized by the Trinity College Dublin. So the day 1, how was basically the outline of this day of the training school was we had needs assessment of wearable and point of care tests for the individual with intellectual disabilities. Then we talked about cancer screening and development and implementation of the equity framework in Ireland. learned about the evidence of effectiveness of different cancer programs in England. Finally, breast and colorectal screening in Denmark was presented, and we had an overview of the cancer prevention policies across EU, Europe. The day after, as I said, was the international conference, very well organized, important topic. And again, you can find more details on this on the CUPID website. After that, we had our group meeting, which was the annual event that we tend to have every year in person. This year, we had it in Athens in July, and you can see here the photo of the group. It was a very nice group. We worked a lot, as you can see on few photos here. We had 34 people present, 17 in person and 17 online for most of the meeting. So what we did, basically, we had an overview of the activities in the previous year. We collected some feedback from our members, and our main focus of the meeting was to work on the policy review. We had 4 groups that analyzed those documents that were collected in the previous period. We organized the reporting, and we added additional search in the Policy Commons database, which you will hear a bit more. And then we discussed other things, our plans, budget, and so on. So again, our main focus is to systematically search, identify, and review policies on cancer prevention across Europe, and assess if intellectual disabilities are addressed. So we searched all 53 European countries, not just EU countries. We searched scientific and regular web databases, so say. We followed the CUPID protocol, which we previously developed. So basically what we did in Athens was data extraction, and we initiated with data synthesis. We had all countries divided into 5 groups, and then divided our members into 5 groups. So each group worked on the specific group of countries to extract and synthesize data. And up until now, in October, the final result is that we have policy searched for all 53 WHO European area countries. In the academic databases, PubMed and Bayes and so on, we also searched Google as a generic one, and as I mentioned, Policy Commons, which is a specialized database for worldwide policies. What we then did in Athens and after, data extraction for all countries with relevant findings, and we started working on the data synthesis, which is almost finished. What is planned for the coming period is a report writing. So from all these information, we tend to write a report, which will be our final deliverable of our group, and obviously would be good to have a publication, a scientific publication out of it, so we will aim to do that as well. So this was like the brief overview of our activities, and yeah, keep following, and we hope to share more exciting stuff soon.
Thank you very much, Dr. Vukovic, for your comprehensive overview of the activities of Working Group 2. For those, because I saw that there are a lot of people who are not CUPID members, and that's good. Dr. Vladimir Vukovic and Professor Dr. Martin Mechun, they are the leaders of the Working Group 2. Now I want to welcome Dr. Kate Sykes and Dr. Vera Dimitrievska, who will present Understanding Cancer Prevention and Screening in People with Intellectual Disabilities, a systematic review of reviews. Their synthesis of evidence will provide a strong basis for our further discussion. Please begin, Dr. Vera Dimitrievska. I hope that you will present, and I know that Dr. Kate Sykes is also here, but okay, I leave the microphone to you.
Thank you, Vladimir. Thank you. Good morning, all. Good afternoon to all of you from where you're based. I think that we have a lot of interest for this annual conference. More than 30 or 40 attendance and participants. So thank you for this opportunity. Thank you to Kate Sykes, who is eagering to move this forward and to make something for people with intellectual disabilities to have a decent life. As you have mentioned in the intro part, I will present an umbrella review as a part of the research agenda of the working group 3 activities. A review of reviews, similar to scoping reviews of what the first working group has been doing. Along with Kate Sykes, we have started doing this, and we are in the just beginning of the phase. So I will explain in more detail how this will actually be realized. As an overview, it will be a brief intro of the project, aims and objectives of the review, roles, what methods, the training for doing this review, and the last part, publishing of the all work, what will be done at the later stage. So this, as I mentioned at the beginning, is part of the activities of the working group 3. And it is an umbrella review as a part of the research agenda involving more than 10 different countries. And so far we have quite good interest to be part of this collaboration work with different countries, and more than 30 people expressed their interest to be part of this work. The main aim and of the objectives of the review is to explore and what can help people with intellectual disabilities to prevent cancer and be screened for cancer, with 3 main objectives: to identify the barriers and the facilitators relating to cancer prevention initiatives for people with intellectual disabilities, to identify the barriers and facilitators related to cancer screening programs for people with intellectual disabilities, and to identify research gaps and recommendations for future research to improve equity and access to cancer prevention initiatives and screening for people with ID. Where does this fit with the working group 3? As mentioned several times with the presentation, is to develop a research agenda, to develop EU-wide cancer prevention guidelines for people with ID. We have developed, thanks to Kate, protocol plan for the umbrella review, which is registered to Prospero tool. It is in an ongoing phase. We have also the number, and all participants, people who express the interest to be part of this review, must approve the submission before the registration can be published to Prospero. This is still ongoing. The roles have been divided, and people expressed their interest through certain Gantt chart where all the activities have been divided, and the run databases search will be responsible only from one person, and the deadline was end of September. Title and abstract screening will be done by 27 people, and all records will be screened by 2 people. The abstract and the title will be managed through the Covidence program, and we have deadline by end of October. The methods that are employed of this umbrella review will follow the PRISM guidelines. Selection criteria and search strategy will follow the databases. We have identified 9 databases, and will be used through several databases via EBSCO, via ProQuest, Scopus database, Cochrane library, and in addition to the electronic databases, the first 100 hits from the Google Scholar will also be retrieved. This is because they will provide the most relevant outputs. As I mentioned, the support will be given mostly through the Covidence tool. The screening will take place. All titles and abstracts will be reviewed, as I mentioned, by 2 reviewers using the all inclusion criteria. We have several inclusion criteria listed, and three exclusion criteria. So we will involve as inclusion criteria people on intellectual with disabilities. We will include reviews that include other conditions such as people with mental health conditions and intellectual disability, as the population does involve people intellectual disability. A note will be made of any other comorbidities that population has. We will include reviews that focus on other populations, healthcare professionals, carers, as long as that data relates to intellectual disability. There is no age limit given cancer prevention can relate to this age, while screening typically is for those 18 plus. Be a systematic review any year, any country. Primary study can use any method. Focus on cancer prevention, smoking, health, eating, physical activity, cancer screening, cervical, breast, colorectal screening, cancer, prostate, and ovarian cancers. And studies would be included if they, for example, discuss preventing avoidable deaths as long as factors relate to cancer. From the exclusion criteria, we will exclude any review that doesn't specifically include evidence of population having an intellectual disability, such as cerebral palsy. No systematic reviews that don't relate to cancer prevention related diseases like smoking, health, eating, physical activity, etc., or cancer screening, cervical, breast, colorectal cancer screening, prostate, and ovarian cancer. The assessment will follow the guidelines of the systematic review of related to bias and quality of the assessment. Tool, AMSTAR 2 was used to assess the risk of the two independent reviews in order to not be duplicate. So the AMSTAR 2 consists of 16 items, is scored as yes, partial yes or no, of which 7 items are considered like critical and 9 non-critical. The data synthesis will be using through the framework of social ecologic model, like a theory-based framework, which is comprised of 5 levels: individual, interpersonal, organizational, community, and policy. And this model proposes that individual behavior and health are affected by the interaction between the characteristic of the individual, the community, and the environment that includes physical, social, and political components. So here is the framework of the social ecological model. And the last part of this review is considered to have at least one paper submitted to a leading journal in this field to disseminate the results of the review independently. If a lot of evidence pop up or is emerging, we may write one paper focusing on screening and one paper focusing on cancer prevention. This is how we're gonna keep in contact with other involved in this review through email. We have a shared drive and monthly meetings organizing by the team lead of the CATE sites. So this is generally a short presentation how we plan to run the umbrella review in the next period of time until the project is ending. So thank you for joining today.
Thank you to our colleague Vladimir Trajkovski. I hope that there will be questions at the end. Now we must go on. I would like to ask all 43 participants who are joined now to stay at the end, and also especially the speakers, because probably there will be some questions for the first 3 presentations. Now it's my turn to share my presentation. Let me share the presentation. Here it is. I'm the leader of the. No, sorry. This is the YouTube, which we are streaming now. Sorry for this. Here it is. Sorry for a little error, because I'm concentrating on as a moderator on several things today. Sorry for this. Okay, I will go briefly. Together, I'm the leader of fourth working group. The vice chair is Professor Jean Kaleaguis, who is joining today from USA. Probably there is night or early morning, and I'm sending her warm regards. This is our working group meeting, which was hybrid, held on Malta on 28th of March. Also, the former president of Malta was joined the working group there, and several of us joined on the Zoom. It was very fruitful meeting, and you can read more on newspaper letter which was published on June this year. Our membership was double from last year. We have 45 members in working group 4. Now we are around 103, 105 persons, more female than email, young researchers, very good number, 40 young researchers, and also we have participants from ITC countries, which is according the COST rules. What are our objectives? Our working group is focuses on dissemination, and we are a service of first 3 groups. Our group is one kind of services, and we are working on our website, accessible website, which is uploaded and on a weekly level, sometimes level, also social media, Facebook, Twitter, blog, so publishing newsletters and accessible information reports, infographics, YouTube videos very oftenly. We have several tasks. I will not mention, they are mentioned on our website, and some of them I already mentioned. Also, we are organizing webinars. We organize a scientific webinar in June, and also this annual conference. Then we are develop annual newsletters. This year, probably we will produce 2 newsletters. Then accessible versions of infographics and other leaflets. Then our task will be to organize the final conference next year, the 3rd week of June. This is our Gantt chart. We finished all our duties for 3rd grant period. Then deliverables to disseminate a plan for knowledge base developed during the CUPID action to all relevant stakeholders, including easy read versions for people with disabilities. We did in the first year on English and Macedonian. Development and launch accessible CUPID website, I also mentioned, in social media as well. Webinars, final conference, again, additional future prospects of the knowledge developed during the CUPID action also will be discussed in our group. How we monitor and evaluate, we use metrics to follow website traffic, event attendance, or public downloads of the papers which are already published, collect feedback from the stakeholders and participants to assess the reach and impact. What are the activities in this 3rd period? We organized online meetings, CUPID Annual Conference last October, 2nd CUPID Annual Conference on 25th, confirmed budget at the end of the 24 year for this year, realized face-to-face meeting in Malta, creating posters, more than 20-30 posters. We create posts almost on the daily level, I would say. Photos from the events, certificates for the training school, which was held in Dublin in May this year. Also scientific webinar with 5 very good presenters, which was held on 19th of June. And also we contribute to ECR workshop, which was held this September in Amsterdam. And we are planning, we start to plan and realize, which we will realize this annual third CUPID conference today. In total, we have 21 publications, scientific articles, leaflets, also easy to read brochures, some papers from newspapers, in total 21, and 5 new since my last presentation on MC meeting in June 2025. You can see here the last 5 papers, and I would like to mention that all of them you can find free access on the CUPID website. Newsletter 3, number 3, was published also on our website this May, and here are the first 2 pages of the newsletter. Also, we support, as I said, with posters, the training school of WG second and third group, which was held from 12 to 14 of May in Dublin. And also we produce certificates for that meeting. I mentioned the scientific webinar, which was moderated by me on the 19th of June, where our colleagues Amina Banda, Anna David, Monika Trajkovska from Poland, Jenny Biru, and Natalie Gill presented a very interesting scientific presentation on that webinar. Also, we support the Early Career Network meeting with posters, and also I was involved and Jean was involved as presenters. Workshop schedule was shown on this slide. Because I'm time frame with 10 minutes, I will not read the speakers, but it was 2-3 weeks ago realized, and it was a very interesting meeting for young researchers. These are the posters for today's conference. Then now I'm going to, we made some with the IT Christian Lamberski, who is the IT manager of the project website. We reorganize in this third year the website, and you can see that on our webpage. It is shown here. Then I'm going to the Facebook. All day, from year to year, we increase the number of our followers. 341 on the Facebook. Also today or tomorrow we'll publish photos of the participants, and I hope that I have permission from all speakers. For those who don't want to appear with photo in the Q&A session, please don't turn on your camera. I must to tell that because that's our job to disseminate this CUPID COST action. Also, LinkedIn is growing, enhancing the number of the followers, around 300 followers on LinkedIn, very professional network. CUPID Next, we are not so active here, only 84 followers, but also we are publishing posters, photos, events on the X platform, and we are publishing photos, pictures on the Instagram. We published 158 posts. We have at this moment 148 followers. Also, I would say that our YouTube is also available free of charge, and we already published 10 videos with this conference, which is live streaming. I would like here to thanks to my colleague Andrea Ivanovska for do that. And also we have only 16 subscribers, but I warmly invite all of you to subscribe. It's free of charge to our channel and to watch our producing videos. What are our next steps for the working group 4? Maintaining the CUPID website in the 4th year, growing the numbers of social media accounts, publishing text posters on social media, publishing texts about CUPID in newspapers on several languages from our members, planning newsletter number 4 for the end of the 2025. Tomorrow probably we will discuss on our MC meeting more on this. Press releases, radio or TV interviews. I invite all of CUPID members to join on their national TV or radio broadcasting networks and to share the idea of CUPID action. Collaborate with stakeholders on national or European level. Planning the WG4 meeting in March in 2026, and also probably the hugest event will be our final conference, which is planned for the 3rd week of June in Brussels next year. Please follow us on social media. Here are the links, and please share our activities on your personal accounts. We will benefit a lot with this if you share. And I will finish. This is the Millennium Cross at the top of the mountain Vodno near Skopje. And probably our next meeting, I will suggest, of the working group 4 will be in Skopje. Who knows? But all of the members of the working group 4 and the MC members should vote for this my proposal. Okay, thank you very much for your attention. And now I'm going to invite the last presenter for today, Natalie Gill, Understanding the Cancer Diagnosis Pathway, Experiences of Adults with Intellectual Disability and Those Who Support Them. Natalie, it is your turn.
Great.
Let's put it on
Thanks,
full
Vlad.
screen, and 10 minutes is yours.
Thank you. Good morning, everyone, and thank you to CUPID for inviting me to present to you this morning. I'm a researcher and trainee health psychologist at the University of Surrey in the UK and a member of CUPID Working Group 1. And today I'll be presenting one of my PhD studies titled The Pathway to Cancer Diagnosis, Experiences of People with an Intellectual Disability and Those Who Support Them. And this study is ongoing, so I'll be sharing the process so far, including the background to the research, the recruitment process, and patient and public involvement and engagement, and then some early findings. So why does this research matter? Well, cancer is the second leading cause of death for adults with intellectual disabilities, and more than half of cases are diagnosed at stage 3 or 4. And one of the most striking findings is that cancer in this population is much more likely to be diagnosed via emergency presentation than through primary care referral. And this reflects a complex set of barriers, including difficulties recognizing and reporting symptoms, challenges with communication, and the risk of diagnostic overshadowing, where symptoms are wrongly attributed to a person's disability. And the most recent LEADER report, which is a national initiative in England that reviews the lives and deaths of people with intellectual disability and autistic people to understand why they often die younger than the general population, highlights that cancer is now a leading cause of potentially avoidable death in people with intellectual disabilities. But there's been limited qualitative research to date in this area, so this study is addressing a really urgent gap. We don't yet know enough about how people with intellectual disability themselves and their support networks experience the cancer diagnostic pathway. So this is a qualitative interview study, and participants included adults with intellectual disabilities who had lived experience of the cancer pathway and advocates who support them. And interviews were semi-structured, lasting between 45 and 60 minutes, either in person at advocacy organisations or online. And this was dependent on the participant needs and preference. And participants were remunerated with a shopping voucher for taking the time to contribute to the research. And ethical approval was received by the University of Surrey's Research and Governance Office in August of 2024. A key strength of this project has been patient and public involvement and engagement. So at the beginning of the research, I convened a PPIE panel at a third sector disability advocacy service in London. And the panel included people with intellectual disabilities, paid and unpaid carers and advocates. And I took my idea for the research to them for discussion, and they agreed that it was necessary research, and they offered advice on how to prepare for the project. They then helped to co-design the participant information sheets and consent forms and the interview schedule. Importantly, PPIE in this project, it wasn't a one-off consultation. It's been an ongoing and embedded process with the panel engaged throughout. And we worked iteratively, refining participant materials and interview tools over multiple rounds to make sure that they were genuinely accessible and fit for purpose. And this approach not only improved the study design, but also reflected the values of inclusivity and partnership that underpin the research. And the panel also advised that I train in Talking Mats, which is an augmentative communication tool to ensure that the research could and would be as inclusive as possible. So recruitment turned out to be one of the most challenging parts of this research. And although we did develop accessible posters and circulated the materials widely, it took over a year from ethical approval to complete 10 interviews. And ultimately, the success in recruitment came through building strong relationships with third sector advocacy organisations. And I had to be prepared to have patience and become known to the community I was working within, to attend community events and build rapport and trust with both advocates and people with intellectual disabilities. I had to learn how to communicate about my research in a way that was truly accessible and engaging. And the recruitment process was challenging, but it taught me a lot about the reality of recruiting seldom heard populations, and particularly the challenges that we face when designing and conducting research with people with an intellectual disability. So the data collected so far, I've completed and transcribed 10 interviews in total, 5 with adults with intellectual disabilities and 5 with advocates or supporters. All of the interviews with people with intellectual disabilities have been analysed, and I'm currently in the final stages of completing analysis of the advocate data set. The analysis is being carried out using reflexive thematic analysis within a constructivist and relativist epistemology. And within this paradigm, knowledge isn't seen as a single fixed truth, but something that people build through their experiences and perspectives, which can vary from person to person or context to context. And this is important as it ensures that the voices and lived realities of people with intellectual disabilities are respected, understood, and central to the research. The coding of the data collected has been inductive to remain close to participant experience. However, I'm also interpreting the findings through 3 health psychology theoretical lenses: the pathway to treatment model, candidacy theory, and the health stigma and discrimination framework. So here's how the analysis process has unfolded. I started with inductive coding, moving through iterative theme development and reflecting continuously on my positionality as a researcher. Once the themes were developed, the 3 frameworks then act as lenses to interpret the themes, helping me to understand how barriers to diagnosis can be explained in terms of healthcare systems, eligibility and access, and experiences of stigma. And on this slide, you can see the thematic map with themes in the central circles and the frameworks overlapping and illuminating them around the outside. And together, these frameworks allow us to move from what participants have said to why those experiences happen and what they mean using theoretical interpretation. And they help to connect personal stories to broader structural and social processes, showing how access and social inequalities intersect. And for research involving people with intellectual disabilities, this multi-framework lens highlights how individual experiences are shaped by system design, social attitudes, and healthcare practices, not just by personal factors. So from the interviews with people with intellectual disabilities, 7 themes have been developed so far. These are some of the themes that we may recognise and which fit with existing scientific literature. invisibility and lack of recognition of needs, which includes things like the absence of intellectual disability nurses or poor recognition of needs. Systemic failures and delayed care, for instance, clear red flag symptoms being dismissed, and communication and coordination, where participants describe feeling unheard in consultations and facing challenges like digital exclusion. And these illustrate some of the barriers that people face when trying to get a timely diagnosis. And I've highlighted each of these with an illustrative quote. Some of the themes that have been developed from the dataset are perhaps more novel, and the first of which is stigma, attitudes, and discrimination, whereby people with intellectual disabilities discuss overt experiences and perceptions of stigma within the health system as a whole, or aim towards them directly. The burden of advocacy, where healthcare was described as a battleground, and good practice and compassionate care, where participants recalled positive adjustments. Finally, demand for change and transformation, which included calls for more training for healthcare professionals and better accessible information. And these themes give a sense of both the challenges and the areas for improvement. The next step with this research is to finalise the analysis of the advocate interviews and then bring together both perspectives for a fuller understanding. From there, I'll move into writing up results and discussion, and I'll also be working with the PPIE panel on how to share findings in accessible formats. Looking back, recruitment was slow and difficult, but incredibly instructive, and PPIE was essential in the success of the research. I'll finish with a reflection. Research with seldom heard groups takes time and adaptation, but it is vital for addressing health inequalities. And as a takeaway, I would invite you all to think about how we as a research community can better embed accessible qualitative methods in all of our health research. And as I so often hear in my work, if we get things right for people with intellectual disabilities, then we will get things right for everyone. I'd just like to acknowledge my fantastic supervisors who are equally passionate about this research as I am. That's Dr. Rob Kerrison, Dr. Anna Cox, and Professor Katrina Whitaker. Thank you all for listening.
Thank you very much, Natalie, for this thought-provoking contribution. And I wish you, as I am informed, you are still not PhD. I wish you good luck in your defending PhD thesis. We have now reached the final part of our agenda. And I invite all participants to join the discussion, share reflections, and ask questions. Together, we can bridge the gap between research, policy, and practice. So, all speakers, please turn on your cameras. And also, for the other people who are listening us and watching, they can raise the hand and join us to give their questions in live, or if they are ashamed, they can type the question in the chat. Please, we are starting we have 13 minutes more until the end. We planned this conference 75 minutes, between 60 and 75 minutes. So we finished our job, speakers, but now I invite the listeners and the people who watching us in the last hour. Irena Stoyanovska, also I would like to thank here, to not forget at the end, her for making photos behind. I made some of them, but she was responsible for making print screens. She said, thank you all for your hard work and the results achieved so far. Looking forward to reading the articles in the near future. Thank you for your contribution, Irena. She was my master student. She's Master of Science and also member of Macedonian Scientific Society for Autism. We expect other ones. Elif Sarac from Turkey. Thank you for this valuable contribution and presentations. Okay, thank you for your contribution. Genevieve Brie, thank you for the really interesting presentation. I'm looking forward hearing from you all when the research is complete. Yes, next year we will have much more results and much more papers, and also some of you will, all of you will be invited, but on the final conference in Brussels. But there are money only for 55, as far as I know, 55, maximum 60%. We'll see next year to cover. CUPID Action can cover the cost only around 55 attendees in Brussels. Other ones must cover their cost from their own, from their universities or associations, etc. Are there concrete questions on this way? We give some annual cross-section of our activities. Zoner Dogan, also a CUPID member from Turkey. Do you know the exact number of people with ID in the UK? This is probably from Natalie Gill question. Epidemiological studies, do you have some concrete, but he asks probably people with ID who have cancer or the total number of people with intellectual disabilities. Zoner?
Sorry, did I understand
Yes,
correctly that
yeah, sorry. Yeah, this question for Natalia, and then that's what I meant for the CUPID. People with ID and cancer.
I'm not sure of the number of people with intellectual disability that have cancer, but there are 1.5 million people with intellectual disabilities in the UK, but this may be an underestimation, as many people are not correctly identified within health records.
Okay, how about with the cancer, or do we know any approximate number, or? No, people with ID and cancer. So, and you say you don't know?
No, I don't know that number off the top of my head, no.
Okay. No, I mean, it seems like we are also struggling to find the exact number in Turkey. I was just wondering, because of, I don't know, ethical issues, or it's kind of secretive. You are facing this kind of problem for some reason. Yeah, and like I was thinking that maybe you may have better statistics or documentation in UK. So that's why I was wondering, but it seemed like you have also
Probably,
similar.
Zoner, probably that could be one of the presentation for the final conference, and we can invite some some doctor of epidemiology, and he or she can give us some overview on the final conference. For example, for Macedonia, we don't have that numbers because we don't have good statistical register. For the UK, there is the better situation, but Natalie is not specialized in that in epidemiology, and so she could not give that answer. But we will try to provide that answer on the final conference.
Yeah,
Probably.
but yeah, I mean,
Tons-
Vladimir, yeah, my understanding is it is kind of challenging to know the exact numbers, and I'm not sure anybody in this group have any idea in
I
any
cannot say
country
about
who can
UK.
have
I
the
cannot
exact
say.
numbers. Yeah, it doesn't matter. We think that we don't have, but it seems like also even other countries like UK, Germany, or US, it seems like most countries are very similar. And
I
again,
can.
in this group,
Yeah,
we
yeah.
have more other experts. If anybody has it,
I
I just
can ask Dr. Margaret Denny or Dr. Oliwia Kowalczyk or Dr. Vladimir Vukovic to say if they have some numbers for Ireland, Serbia, or Poland. Please turn on your microphone, Margaret.
So I can say for Serbia and for many countries, in order to have these data, you would need to link them. So you would have to have a linkage of the personal health records, which in many European countries, it does not exist. I'm not referring to EU only, Europe. So for Serbia, we more certainly do not have, but there might be some numbers, but I'm not sure if, like Natalie said, anyone can give it exact numbers. So those are all underestimations, because a lot of people are undiagnosed, especially those with mild ID, and depend on how long these people have been followed so to understand if they develop cancer further on. But for sure, that is a challenge, as you all said.
Yeah, I agree with you, Vladimir. Probably we should think in CUPID on MC meeting for the next projects to go more epidemiologically on this issue, statistical issue and epidemiological issues on cancer in people with intellectual disabilities. Margaret, please.
I know in Ireland we have 66,000 people with intellectual disability. However, there are no clear numbers in terms of cancer, but there is a higher incidence of gastrointestinal cancer within Ireland. And certainly the numbers are not interesting. Yeah, thank you.
Okay, Oliwia, please, short overview.
Similarly to Poland, and I think the main problem is, as Vladimir already mentioned, they are under-researched and under-diagnosed, but also the problem is that when they come to the oncological centers, there is no, a table to tick that they have intellectual disabilities. So they are, even if they are diagnosed with cancer, there is no mentioning about the ID. So that's the problem for the statistical numbers.
Okay, thank you, all three of you, for your comments about your countries. There is one more positive overview of our conference from Milena from Macedonia. Thank you for your informative, interesting presentation. Looking forward for the results of your research on the end. If there are no more questions, I would like to ask the speakers if they want to add or to say before I close the conference, if you want to add or to say something, because Dr. Margaret, Denny, please.
I would just like to compliment Natalie on her very interesting research. And one phrase caught me really during her presentation was, slow care is good care. And I think that's so interesting in terms of your research. And I just wish you all the best. It sounds so interesting and so thought-provoking. Thank you.
Thank you, Margaret.
Yeah, I mentioned that in my closing her presentation, very thought-provoking and very inspired presentation, and I wish her good luck in defending the... Oh, hello from Australia. We have attendees from Australia. My name is Sally. Thank you so much for such interesting presentation. I look forward to reading your publications. Thank you for watching us. There is evening, as I know, in Australia. So good evening there. Okay, if there are no another comments, it's 11:15 almost. Then I would, on behalf of the CUPID COST Action, I would like to thank all presenters, participants, also the CUPID leaders, Dr. Susan Denny, who joined us in the first half, and she has some commitments, and especially to the grant holder Françoise Heike for their support in the background with organizing Zoom link, giving us co-host to be co-host, and for all her job which she has done for in last 2 years for the CUPID, and also, as I mentioned, to Andrea Ivanovska and to Irena Stoyanovska for making videos and photos, helping me to organize this conference, and for their dedication. Let us continue to work together towards more inclusive cancer prevention and health promotion for individuals with intellectual disabilities. And with these sentences, I officially want to close third CUPID Annual Conference, to thank of you to remind MC members that have a meeting, I think in 10:30 Central European time. And the next CUPID webinar or conference or meeting, I would like to thank all of you and to wish you good luck and stay safe with your health. Bye-bye for now. Best regards from Macedonia to all of you, to all European countries, to USA, to Australia. A very good attendance today from almost from all over the world.
Well done, Professor Vladimir. Well done.
Thank you, Dr. Margaret.
Thank you, everyone.
Keep in touch
thank you.
by email. Bye-bye, all of you.
Bye-bye.
Bye-bye. Bye-bye.